medications, help solve any mysteries. Also wanted to lay this out over here as well, that this session is not meant to sort of, replace the advice or, the suggestions and the expert opinion given by your own primary doctors and your specialists. This session is just to sort of reach out to the community. I just want to lay this clear. It does not replace your medications or anything of that sort. We will not be prescribing anything or ordering any tests, but we can certainly suggest some of the stuff which you can go back to your doctors and sort of ask them. I'll give the stage to Nasir over here. Nasir, you want to say some 2 words?
Assalamu alaikum. Basically, the session is a question and answer. We won't be giving any speeches. So any questions you guys have about diabetes, hypertension, preventive medicine, any questions at all, feel free to ask.
Yes, thank you, Nasir. So, we also, Sarfraz Bhai has actually emailed this website as well. You probably have received it in the Zanavia group. There's a passcode over there. Just click on that link, go to that website, type your name, put the question. This is for people who feel uncomfortable asking a question, but feel free to reach out to us right now. You can raise your hand, stand up, sit down, whatever, and then ask any questions. And hopefully we can, sort of give our 2 cents. Oh, there's a question. What can people do to save themselves from diabetes? So basically you're talking about prevention. I'll ask Nasir to elaborate on that.
So preventing of diabetes, good question. That's probably one of the biggest concerns we have in our community. Exercise and diet, of course. Number 1 is exercise. Stay active. If you're very sedentary, your chance of diabetes increases tremendously. Second thing is diet. So in diet, when we talk about diet, we're talking about juices, soda, sweet tea, Gatorade. That's probably the easiest way to help with diabetes or prevent diabetes. Do not drink sugary drinks, because we drink a lot of, a Coke, soda, sweet tea, Gatorade. These all add up. So an easy way is prevent any sugary drinks. Don't eat late night, except for Ramadan, of course. But eating late night will definitely spike your sugar. So eating after, let's say, 8 o'clock at night will cause your sugars to increase. So when it's not Ramadan, don't eat at night. Avoid heavy sugary meals and exercise. Activity is going to make a big difference in your chance of getting diabetes. So those are the big 3.
Dr. Nasir, do you think any genetic predisposition type 2 diabetes?
Of course. Right. I mean, some people who are type 1 diabetic or insulin dependent are going to get diabetes even if they're skinny and eating right. So those people, unfortunately, will have to be on insulin. So that is not going to change. So there's certain, if you're obese, for example, if your BMI, body mass index is above 30, your chance of diabetes again increase. So decreasing your weight will make a big difference for diabetes. And other factors, for example, sleep. People who lack sleep, people who only sleep 5 hours a day, will get more likely of getting diabetes. So things that keep you healthy are going to keep you from getting diabetes.
Yes, thank you. That was an excellent question. And there's a difference between type 2, type 1 diabetes, right, Nasir? And now I got this mic over here, so yes. So type 1, type 2 diabetes is gestational diabetes as well during pregnancy and so on and so forth. So there are different types of diabetes and they're different, managed differently. So this was a good question, but this is more of a sort of a general question. If you guys have any specific questions about medications, everything, feel free to, bring your questions forward.
On hypertension, how much diet plays a role that you can, forget about medicines, and you can control your hypertension with food. Is that possible?
So hypertension can be improved with diet for sure. For example, caffeine intake will have a big effect on, if I ask some people, they don't realize how much caffeine they're having, but they're drinking 4 or 5 cups of coffee a day. That can have a big effect on your blood pressure. Salt intake. Salt intake varies. Some people it helps them, some people it doesn't make a difference. So decreasing salt, caffeine, those things will help with your blood pressure for sure. And of course, if you decrease your caloric intake, your BMI is going to go down, your body mass index. And if your weight is less, your blood pressure will drop. So for, every 10 pounds you lose, you're going to lose some blood pressure. So weight, which is calories, which is what you eat, salt and caffeine.
Are there some recommendations regarding hypertension about how intensive workouts?
Regarding hypertension and exercise, at least I would recommend 30 minutes, at least 4 days a week. There's varying amount how many minutes you need to exercise for activity. Some people say 90 minutes, 100 minutes. If you try to do half an hour, 4 days a week of dedicated exercise, not activities of daily living, gardening and walking around, counting your steps doesn't count. Dedicated exercise, half an hour will definitely improve your blood pressure. If you have any comments on that.
That's actually very good. But Nasir got this question over here. Is ghee clarified butter better than vegetable oil? You want to take it?
Ghee. So there are different types of ghee. There's vegetarian ghee, there's milk ghee. But I think clarified, what's the question? Clarified butter is a type of ghee, actually.
Yeah.
And I know there's some benefits. Some people drink bulletproof coffee and they add the ghee to their coffee. But the ghee in general is going to increase your cardiovascular risk.
Right.
Because it's hydrogenated.
So
No,
it's not good. It's not good.
I know some people drink it with coffee, the bulletproof diet, and they drink ghee with coffee. So if you have a small amount, it may be beneficial, but I think in large amounts of ghee in general, if you ask people who've had a heart attack, they've eaten a lot of ghee in their lifetime. So I would not recommend ghee, for sure.
So you definitely want some other oils like olive oil and,
Yeah, I think olive oil and
the better of the oils.
sunflower oil might be better.
Polyunsaturated omega-3 fatty acids, which are rich in that. So that's what we sort of aim for, right? But the ghee would be more saturated fat, and this is exactly goes along with the fact that it can go up and plug up your arteries in the brain and the heart and so on and so forth. So we definitely would not encourage.
And a lot of times ghee is hydrogenated, meaning they boil it so it becomes a little bit different. So
Right.
Ghee I wouldn't recommend.
Butter effect on the diabetes, not that we know of.
No, I don't think
right,
it will affect
yeah,
your diabetes.
I don't think so. But it
it'll
can plug up
cause
the arteries.
blockages into arteries. So in general, you want to try to avoid butter. In small amounts is okay, but not large amounts.
What about multivitamins? Sometimes people say that, people say that take that, and other people say that don't go.
Yeah.
And over-the-counter.
I think the goal would be to eat a balanced diet so you don't need a multivitamin. Because if you take a multivitamin, you're dependent on multivitamin, you're less likely to eat proper. If you're trying to get a wide variety of foods, greens, oranges, different colors of food in your diet, you're going to get all the vitamins you need. So taking extra vitamins I don't think will necessarily help. There's no proven benefit of a multivitamin. Unless you're an alcoholic or you have some type of GI issue where you cannot absorb nutrition, or you've had a gastric bypass, you cannot absorb nutrition, that's when the multivitamins, vitamin B12, vitamin D will help. But if you're a healthy individual, it won't help unless you have a deficiency. So if you check your blood work and you have a B12 deficiency, vitamin D deficiency, those pills will help. But other than...
Say someone is not getting enough sunlight.
Then you can take a vitamin D supplement. So vitamin D, B12 are very specific, but a multivitamin is not very specific. So
I completely agree with Nasir. So there's not been any shown advantage of taking, these multivitamins and everything. I think this is sort of a, scam where, all these shelves are full from vitamin A till C. So they're really not very helpful, right? So Dr. Nasir is 100% correct. So some of the things which we check in our clinical practice, especially with people who have chronic kidney disease, is vitamin D, the way, Dr. Mehdi has alluded to. So vitamin D, sunshine vitamin, that definitely you can get deficient, especially in the northern hemisphere or the Midwest. I used to practice in Minnesota. There was hardly anybody actually who had a normal vitamin D level.
yeah, even here barely.
Right. So vitamin D, low vitamin D levels, even up until the heart as well. I mean, they've figured out that, vitamin D is helpful for the bones, for the muscles, for the heart. And now these psychiatrists are checking vitamin D levels all the time because vitamin D has a great impact on depression. So especially in the winter time, when the vitamin D level, when the sunlight is low, especially in the northern hemisphere, we're talking about European countries and Scandinavian and the Midwest over here in the US, Canada, vitamin D would be one thing. Then what he brought up a great point about, alcoholics that, they can get deficient in folic acid, B12, thiamine, B1, B6, B12. And then some of these vitamins, like say if people are having neuropathic pain, they're having neurological symptoms, so those vitamins can really help, like vitamin B12, what Dr. Nasir was saying. So vitamins in general, if you're doing fine, if you have a balanced diet, so the way I look at it is, this is your plate which is round. half is fruits and vegetables and half is lean protein, and that's it, you're done. Unfortunately, over here, we are sort of doing the late night, iftars and everything, which sort of becomes counterproductive for us, right? And then, we're sitting on that food, we're not able to digest that, and then, the next moment you find is the sehri time. So you're going to overeat, leads to GERD, hypertension, acid reflux, so many different things. So, but great question.
Neuropathic pain only hand or only feet too?
Yes, Nasir.
The question is, the neuropathic pain
Is it only in hands or is it in feet or both?
Usually if it's like diabetic neuropathy, it'll be in both feet, both hands.
Right.
Usually start with the feet. If it's one hand, there might be like a nerve impingement, maybe from the neck or from the wrist or from the elbow. So if it's systemic, it's usually both-sided.
Keeping and putting something weight is
Also there is neuropathy pain.
sometimes you cannot take a weight.
Can't pick up heavy things.
Yes, so, yeah.
It could be neuropathy. You could have
Yeah.
weakness because of the numbness in the hands.
Yeah, and yes and no, right? Because, it could be the way Dr. Nasir is saying, it could come from the spine. So the duration of diabetes matters a lot, because first of all, we see that the eyes get affected very easily, right? And retinopathy, that's what we call it. There are two classes, proliferative and non-proliferative. We're not going to get into that. But what we've seen is proliferative retinopathy correlates very well with diabetic nephropathy, which means that, people who get 10-15 years of uncontrolled diabetes, almost always, 90% of the times, they can get their kidneys infected as well. So unfortunately, that's one part. The second part is, when diabetes is lingering on, I think retinopathy and neuropathy probably have the same, time frame. The way Dr. Nasir is saying, it's glove and stocking appearance, right? So you can get it in the, feet and the hands. It's sharp needle-like pain, especially at nighttime, wakes you up. You have to differentiate this between restless leg syndrome and neuropathic pain, right, Nasir? So restless leg syndrome is mostly when people are just restless, they have to shake their legs and to stand up and start walking. They usually have an uneasy feeling in their legs, and that is not consistent with neuropathic pain. That is basically that, you could have iron deficiency or something else which is leading to restless leg syndrome. We've seen a lot of people who have kidney failure, they get a lot of restless leg syndrome, they have to get up at night and start walking. That is not neuropathic pain. Neuropathic pain is that burning, sharp needles, which usually affects at nighttime and in the hands as well. And of course, you can feel numb in the hands. One thing which you have to differentiate between neuropathic pain and especially in the hands.
Like bee stings, like ant bites or bee
Yeah,
stings.
it's something like pins and needles, just stabbing you. But something which you have to differentiate basically, and that what Dr. Nasir was talking about is carpal tunnel syndrome. So the carpal tunnel, usually these three fingers will be affected, and it usually happens in people who are doing a lot of typing. So this carpal tunnel actually is a tunnel right here, and the median nerve just goes right below that. So when people are putting their hands like this for 10 hours, 8 hours, whatever, and they start getting that pain, that is kind of a neuropathic pain, but not because of diabetes. So one has to differentiate. And one of the biggest factors in that is it's usually unilateral, which means it's going to be in one hand and usually not in both. So that's one of the things. But then there's so many other nerves. The way Dr. Nasir was saying, it could be coming from the spine as well, which can lead to the weakness. But in a diabetic, in short, for 10-15 years, and if you have pain or aches and pains, mostly sharp needles like in both hands is diabetic neuropathy until proven otherwise.
Gabapentin will
We
definitely help.
can talk about different, treatment
I
strategies.
think
right?
gabapentin is like the primary treatment for diabetic neuropathy. So it's pretty common. Gabapentin, there's another medicine called Lyrica. Lyrica works pretty good too for that pain. So it's after, like you said, 15 years of diabetes. Well, you get this needles, like something's biting you. Like bees are biting you or ants are biting you on your feet.
So gabapentin and Lyrica are these two, wonderful medications. Something which I use in my practice quite a bit is Cymbalta, duloxetine, right? So that is, not a FDA-approved indication, but all, internal medicine physicians and general doctors, they would use that. So Cymbalta, the way that works is basically, it's supposed to help with depression and anxiety, but it does help with neuropathic pain as well. The good side about Cymbalta is that gabapentin and Lyrica may have a lot of side effects like dizziness, drowsiness, uneven, they get a little bit imbalanced. At times, in the elderly patients, they can start having hallucinations as well. But Cymbalta is something we reserve. I've tried amitriptyline as well, nortriptyline, those sort of, non-FDA approved approved indications, but those are some of the things we can use. Then something, we can go with alternative medicine as well. Acupuncture helps a lot with diabetic neuropathic pain. It just works miracles, like for, 3-week session or 4-week session. And then people, what they do is, they pick up this acupuncture for like 3 months, then they give a break for 3 months, then they pick it up for 3 months. It just wonders. Something which I personally used to practice a lot is acupressure. There's these pressure points, and then Maula Ali has said as well, Durud padne par Muhammad wa ali Muhammad. So Imam Ali basically has said that every ailment, with every disease which you have, the cure is in your own body. It's unbelievable. This statement of Imam Ali in Najul Balagha is just mind-rocking. So what that means is, maybe, I don't know what that means, but what we can figure out is that, this palm of the hand and the soles of the feet, if you just type reflexology, and there's a chart which will come up, and that chart will show that, okay, this finger is for eye pain, this finger is for kidney problem, this is for stones. Right, Nasir? I don't know if you've seen that. I practiced a lot of reflexology in the past, after I've done MBBS. But some of this alternative therapy, don't be scared of asking a physician. Unfortunately, Medicare does not approve of that because, they look at it like as alternative medicine, so you may have to pay out of pocket. But something like that, will be very, helpful, other than, just being loaded on medications and medications. But that was, excellent question. Anyone else?
About the different brand of the vitamins.
We were just talking about that.
Some of them are cheaper, some of them are more expensive. Which brand?
Stay away from everything. Stay away from all the brands.
Vitamin could be trusted more.
Yeah, so it's a difficult question because there's so many brands out there. I know with fish oil, for example, with fish oil, in that you want to get a high-end brand. You want to pay the money because you want to get the mercury. You don't want mercury in the fish oil. So the higher-end versions of the fish oil will be better. But for the other vitamins like vitamin C, vitamin D you can get higher-end brands. But usually if you pay more, you're going to get more. But unless they're trying to sell you multivitamins, like if you're saying, hey, you can get 8 foods in one pill, don't bother with that. But if it's one vitamin, aspirin, it doesn't matter.
Beer is fine.
Beer, aspirin,
the enteric coated 81 milligrams, that'd be the only one which I would recommend, right? Yeah.
Could you trust the herbalists when they recommend to take some more natural?
Yeah, natural stuff always works, right? I mean, Imam Ali talks about this, and Najul Balagha, Rasulullah talks about this, all the time. But so there's a lot of medications, and I want to be clear on this, right, Nasir? That especially a lot of people are on blood thinners like Coumadin. So, so a lot of people actually, so the problem with the herbal medications is, a lot of people are taking these days like blood thinners like Coumadin, which is, other name is warfarin, and Coumadin can react with literally everything. You're talking about the greens, you're talking about garlic, I mean, you name it and it does it. Anything which has vitamin K is going to go against it. So you have to be careful. We do not want to give advice on herbal medications because, you could be taking a blood thinner which could interact with, or it could be taking, like some of the rheumatological medications as well these days, which can increase or decrease the levels of the medicines in the body. So usually with the herbal medications, we try not to give, too much on that. But definitely turmeric and, some other things, which are Ima and Helibath have told us about, they definitely have anti-inflammatory properties, and we know they work really, really good. But again, as I said, even turmeric can interact with Coumadin as well, so you got to be very careful with those things. So this advice which you're giving is not supposed to in lieu of your primary doctor's, suggestions or their medical expert opinion. This is just sort of a general thing.
I agree. I think that's a good answer.
Right. What is the time for prayers? We still have time, right? Okay. We have 45 minutes, Zafar bhai? Okay, all right. We are Shias, it's okay, we can delay this, right? So, okay. So yes, what other questions you guys may have? Like something about arthritis and stuff. I mean, let's go beyond diabetes and hypertension. Let's think outside the box over here. We're fed up of diabetes and hypertension. Stroke. Let's talk about stroke. What do you want to know about stroke?
What's the reason?
Yes.
happened to a close person to me, and then we talked to the neurologist, we talked to the heart specialist. I said, what caused that? They said, we don't know. And I'm not surprised when they said, we don't know. What does it mean to the specialist, you know?
Yes, or Nasir, you want to take this?
How do we prevent that? Prevention is the most important part of what happens.
Right, I agree. Prevention is number one. So what is a stroke? It's basically a heart attack of the brain. Basically, a blood vessel has been blocked by some type of blood clot or plaque. So you've had a obstruction of the blood flow to the brain.
There is a two, I think. The size of the blood cell will be changed, or the width will be.
So it's usually occlusion, meaning there's a blockade of the blood flow to the brain. So if the blood vessel is small, it doesn't take much to have a stroke. So how do you prevent a stroke and what causes stroke? The same thing that prevent heart attacks, diabetes, prevent strokes. Keeping your blood pressure down. High blood pressure will definitely cause stroke. If your blood pressure is 180, you're much more highly likely to get a stroke. Having high blood pressure, diabetes, if your sugars are high, your blood's going to be sticky, so you're more likely to have a stroke. And then if you have, certain congenital issues, for example, if you have a hole in the heart, you can have a stroke. If you have an irregular heartbeat, that can cause a blood clot to come from the heart into the brain. It can cause a stroke. So multiple things. Sometimes they never find out what caused the stroke. So those are the big items that cause stroke.
So I agree with Dr. Nasir, so in the big scheme of things, right, the way Dr. Nasir is saying, there are two types of stroke. One is a ischemic stroke, right? Other is a hemorrhagic stroke. Then there are other strokes as well. It can be from a ischemic stroke, which is because of a blood clot getting occluded, the way he's pointing out. The blood clot gets stuck, and then, that causes symptoms, like weakness on the arm, of the face, of the tongue, inability to talk, and so on and so forth, or swallow. And the other is hemorrhagic stroke, which usually happens in people who have hypertension history, uncontrolled. When the blood pressure goes over 240, over 140, and there ruptures one of the big vessels in the brain, or, one of the arteries in the brain. So these two different types of stroke, so with stroke, the key is, if somebody is having difficulty talking or a new onset of weakness in the arm or the face, time is muscle. So basically what you want to do is you want to save that part of the area of the brain which is lacking oxygen, right? Because of that blockage, oxygen is not going to the brain. So the first thing you have to do is call 911 as soon as you can. Do not try to get in the car and run to the hospital, because the ambulances can definitely drive faster than you, right? Second thing is, when family is trying to drive, then of course, they're always, hustling and whatever, and they're nervous, everything, so they may not be able to tell. The good thing about the stroke system in the US over here is, like, even if it's a small town, they will activate the stroke, just like the cath lab they activate for the heart, they can activate the stroke lab where, these neurologists, these interventional neurologists, and my friend and my brother, Akil Pavani, is actually not here, and he does all these fancy things, right?
Yeah.
So I wish, when Akil will be here next time, then we can talk about this. But so, what they do is, once you get over there, they do scan your brain right away with a CT scan without contrast, and they look at the brain. First of all, basically, the reason for the scan is to make sure that there is no bleed in the brain. If there's a bleed in the brain, they do not want to give a medicine which can bust that clot open. Because if that's going to happen, then they're already bleeding, and that is a blood thinner that can cause exactly a catastrophic bleed, and the patient can die. So that is the whole purpose of the CT scan. And then so on and so forth, and then, let the doctors handle it. The way Dr. Nasir is saying, how to prevent it, well, whatever prevents, the way he said about hypertension and diabetes prevents that, walking and everything and exercise and not eating the ghee and, this question which we got. But the most important thing is that if you have definitely family history of strokes, maybe you have more, propensity to getting more strokes. Then there's all this vasculitis, like, lupus patients can get strokes, right?
Yeah, that's a good point.
Right, and other patients, like, people who have kidney failure, they could be more prone to getting strokes and so on and so forth. But diabetics, they will definitely, at least, the risk is very, very high and high. in getting a heart attack and a stroke, So that is your biggest two risk factors, is your hypertension and your diabetes.
And then for hypertension, I think a lot of people who come in for a stroke, it's usually the first time they're having a stroke, and they've never checked their blood pressure. So I think once in a while, check your blood pressure. If you're over 40, check your blood pressure, because it may be higher than you think. I think people come in, they never know they've had high blood pressure.
Next topic is the joint and heart person. Artery.
Arteries, right.
How could we take care of that?
Yeah, as you know, Dr. Nasir is saying, there's this irregular rhythm of the heart called AFib. I'm sure, a lot of people know that. Dr. Shamsi, Dr. Kirimi are sitting over here, they specialize in this. So that AFib is just, when the heart is not pumping like this, but it's just quivering, right? That can form a blood clot in one of the portion of the heart, and that can break loose and go into the brain and cause stroke. Some people can actually feel that coming on because they get this heart pounding feeling, palpitations. But some people may not know it. So when they come in, the way Dr. Nasir is saying, they come the first time they roll into the ER, they've had a big back stroke, they do the EKG and they find out they're in AFib. Unfortunately, they did not know they were in this irregular rhythm of the heart. So there's so many risk factors, sorry. But how to keep your arteries clean? I mean, that's the same thing. Exercise, lose weight, eat healthy, low carb, low cholesterol, low salt. All of these things will help you go, long ways. Now, some people get unlucky. I mean, they have aneurysm in the brain of the arteries, which means that, that there is this weakening of the blood vessels where, one can actually, form a clot, and that clot can actually break loose and cause a stroke, or that blood vessel can actually rupture. So with that, I mean, nobody can actually prevent that, because if, somebody, could be walking and drop dead because, they had an aneurysm they did not know of. Some diseases we know genetically they have more aneurysms, which can actually get transferred, like autosomal dominant polycystic kidney disease is one of the conditions where families can have, aneurysms. And then there's so many other diseases as well. But if there's a risk like that, and if they have headaches, yes, we do recommend doing an MRI sooner than later. And, if there's an aneurysm, go to somebody like Dr. Akil Pabani, who, specializes in this, sort of a neurologist who has specialized in this. But again, some people, the unfortunate part is diabetes equals heart disease, equals brain disease, and diabetics are more at risk for getting heart attacks and strokes.
Thank you.
Jazakallah. Thank you very much for having me.
Thank you.